Welcome to week 5, and this week we will cover chapters 13 through 16. However, this is lecture 1 of 2, and its emphasis is on chapters 13 and 14, public health and moral integrity. In chapter 13, our emphasis is on public health. Public health can be defined as a profession. It can also be defined as a set of activities whose goal is to prevent, promote, and protect the well-being of individuals and the community at large. The mission of public health includes disease prevention and health promotion that involves the community. Public health mission is broad and includes more than the treatment of diseases. Public health aims to enhance health of individuals. It also aims to treat communities and larger populations. The profession of public health thrives from partnerships within numerous areas of healthcare. Primary functions of public health includes immunizations, communicable disease control, and disease surveillance. Local and state health departments fall under the umbrella of public health. Additionally, there are numerous federal government agencies under this umbrella. To name a few, the Agency for Healthcare Research and Quality, the Agency for Toxic Substances and Disease Registry, Centers for Disease Control and Prevention, Food and Drug Administration, and the National Institute of Health. These are just a few, but there are numerous others. A key benefit of public health for American citizens is the promotion of healthy lifestyle, which also lengthens the lifespan of American citizens. Public health administrators must be able to work in both government and private organizations and manage a divergent workforce. Public health administrators share some of the same ethical challenges as healthcare administrators. They also have unique ethics challenges. Public health administrators must understand the public health systems and its workforce to serve their organization and the industry effectively. Many professionals in public health have a specific area of specialty in public health. Many are epidemiologists, some are environmental specialists, and there are many others, but those are just to name a few. Healthy People 2020 serves as a model for public health efforts for our nation. It has goals that addresses preventable diseases and premature death. To attain these goals, emphasis is placed on about 38 focus areas. And the focus areas include, but are not limited to, obesity, tobacco use, oral health, injury and violence, environmental health, and of course, access to healthcare services. The ethics of public health includes ideas of consequentialism. For public health, goodness is concerned with the effort to improve health and prolong the life. Social justice forms the foundation for public health activities. To achieve social justice goals, individuals may have to give up some of their autonomy rights. The principle of justice serves as an ethical foundation for public health. The most obvious principle is the concern for individual autonomy as it relates to the health of a population or community. The principle of non-maleficence is also a foundation for public health actions. This includes the entire scope of the public health system with its mission to prevent disease and to promote health for populations and communities. Therefore, first do no harm is an integral part of the entire public health system. A sister principle to non-maleficence is the principle of beneficence. It is also applied to the ethics foundation of public health. Social beneficence influences public health programs on the local, state, national, and international levels. The emphasis is on eliminating or diminishing areas that inhibit individuals and populations from the highest possible quality of life. Public health affects every American from the beginning of their lifespan until the end of their lifespan. Therefore, public health requires a unique code of ethics to guide its mission and its professionals. Public health administrators have a duty to improve their understanding of health issues and the knowledge needed for effective policy making. Public health administrators must respect the dignity of human beings. This means that public health administrators must balance cost effectiveness with respect for humanity, very similar to what healthcare administrators have to juggle and balance. The Public Health Code of Ethics links to the foundation of public health itself. The Affordable Care Act of 2010 seeks to address public health issues via its National Prevention Strategy, which provides guidelines and mechanisms for working with the private sector on critical public health issues. Furthermore, the implementation of Healthy People 2020 is also included. Now that we have reviewed the purpose and role of public health, let's turn our attention to Chapter 14, Moral Integrity. This chapter addresses definitions of morality, discuss and expand on expert ideas on the topic of morality, discuss the breaking of the compass, or the moral compass if you will, and also identify what personal moral integrity is. Let's first define morality. Morality involves the choices that help you or I live successfully with others. It provides guidelines about what should be valued. Ethics is a way to study morality. It provides tools and resources to go beyond morality. Morality can be divided into personal behavior and society behavior. It also includes group moral behavior. Morality is a way to apply ethics through action. Using practical wisdom helps to increase morality. Making responsible moral choices demonstrates moral behavior. Administrators who actively use theory, principles, and practical wisdom are known to possess character and integrity. Your textbook highlights a few philosophers that shared their expertise on the topic of morality. Let's first take a look at Palmer. Palmer's belief of morality is that it stems from your heart. You really act out of love and out of kindness, and what you do is sincere, thus yielding positive behavior and other actions. Johnson believed that characteristics such as integrity, humility, reverence, and justice are essential traits of leaders that produce moral behavior. Turok sought to understand the moral behaviors of a group and believed that service and excellence contributed to both, or was a result of, business success and an individual's moral center or moral composition. There is no question regarding the role morality plays in regards to earning trust of others and making effective business decisions. Nevertheless, moral derailment can happen. Such derailment might occur when one's moral compass is broken. A broken compass might occur due to ethical erosion. Ethical erosion occurs when administrators slowly move away from positive values, or from their positive values. They make small decisions that are expedient but may undermine mission and values. Ethical erosion can be prevented through the application of ethical wisdom. Organizations must work to resolve unethical situations, and the health administrators must constantly be aware of any type of issues or problems or chaos within their organization and find the root cause of that to try to alleviate undesirable behavior. Actions to prevent ethical erosions are important, as patient satisfaction, employee satisfaction all connects to the fiscal success and overall productivity of the organization. When administrators exhibit certain qualities, they have the ability to create adverse effects for their employees and their organization. These qualities include overriding ambition, inflated egos, and arrogance. Johnson's remind us that the dark side of deceit exists for healthcare administrators. Thus, it is imperative that as administrators or healthcare leaders at large, that you preserve your moral compass and do not allow your external environment to define who you are or alter your moral composition. Administrators must also avoid having favorites, if you will, amongst their employees, patients, stakeholders, anyone. It is imperative that the administrator maintain consistency of treatment throughout the organization for clients, employees, patients, etc. That will go a long way and reduce the possibility of conflicting loyalties, which could also cause major problems. Let's look at the existence of administrative evil. Administrative evil exists when organizations and people find pride in participating in actions that negatively affect those who are not valued. Evil can occur when the intent is ethical, but the patient is not considered. Even a small dose of this evil, such as labeling, can lead to undesirable outcomes. Administrative actions that are efficient, effective, and cost appropriate can also be evil or have the wrong motive, if you will. Organizations forget about humanity and just really focus on the bottom line or that mighty dollar. Examples of evil can fall into various categories such as perverse enjoyment, deceit, and bureaucratic approved injury and destruction. How can you, as a healthcare administrator, safeguard your moral integrity? The textbook recommends maintaining a sense of spirituality, and I definitely have to agree with that. That's why we teach at a Christian university, and our primary focus is to help groom and educate you as students so that you are able to become effective servant leaders who display Christ-like characteristics within your organization. So definitely having that connection and that sense of spiritualness is essential and is a key component to your success. Administrators are a moral beacon. They foster integrity within their organizations. They may use participative management and allow contrary opinions and ideas. They have a duty to self-care and personal quality management. But whatever you do, you must be diligent. A little something to ponder about. Do you believe that you can be moral and successful in healthcare? Just think about that. Here's your reference, which was your textbook. And now you're almost there. This concludes part 1 of your last lecture for this course. Let's now pause and take some time to complete your self-assessment for chapters 13 and 14. Remember to email your professor with any questions.